Hey, Suzanne, thank you so much. Hopefully everybody can hear me okay, whatever part of the world that you happen to be in today. I happen to be in Central Florida. It's a beautiful day here, and I'm hoping that the lawn service guys are not coming this Wednesday to mow my lawn. I'm not sure what my schedule is, but we may hear them at some point. So hope everyone had a great Thanksgiving and hopefully a great holiday season coming up for each and every one of you guys. So today, thank you to Zomedica. We're here to talk a little bit about arthritis and maybe where some newer therapies fit into a multimodal approach for both dogs and cats. Suzanne already introduced me. Again, I'm in private practice in the Tampa Bay area for over 25 years. I do some locum teaching at Colorado State. I do have some commercial relationships, and the one that's important today would be with Zomedica, our sponsor. And we will talk about a couple of their products, and I'll certainly make you aware of when we are speaking of those. Okay, let's talk about osteoarthritis, guys. Certain facts that we as doctors all know, that osteoarthritis can be created by a variety of different causes. It can be genetic, it can be traumatic, it can be age-related. But the bottom line is we have a change in bone and cartilage, either within one or multiple joints of the body, that creates new bone remodeling, chronic inflammation, and a very important term that we're going to talk about in a little bit called chronic maladaptive or neurogenic pain. It's a progressively painful and disabling disorder for not only people, but for many of our dogs and cats as they get older. These are just a few of my actual animals here on the screen. Arthritis affects 80 to 90% of geriatric dogs and cats radiographically, and probably between 40 and 60% of them clinically. So it is an important disease for all of us in practice. We see it quite frequently. As far as this concept of adaptive versus maladaptive pain, it's a real important thing to understand because we do have a lot of treatments nowadays that can address this chronic pain or this chronic maladaptive pain phenomenon. So let's take a look at my cat here, Roxy. She's actually sleeping on the couch over my shoulder right now, but she's on your screen as well. So if we think about the concept of acute pain or adaptive pain, this is a protective phenomenon. It has biologic value. It protects the patient. It's of short duration, and it evokes a response that then hopefully allows you to heal and get over whatever insults you were having. So if we looked at Roxy, for example, and let's say she put her paw up on the stove today and she felt that warm sensation in her toes and stimulated those nociceptors, she would have neurologic transmission to the spinal cord, to the brain, and there would be a response where the brain would turn around and tell her, hey, move that paw, get that off of that burner so that we can get rid of the insult and then begin the healing phase. So again, that's a good thing for the organism. That's how we respond and hopefully get away from painful stimuli. Maladaptive pain, which we can see in a variety of diseases, but especially with osteoarthritis, is something that doesn't resolve over time. There's always an insult there, but unfortunately the body in its adaptive phase or maladaptive phase makes more of a mountain than it should. There's no biologic benefit to this. There's a chronic, nagging, bothersome pain response that continues to escalate over time and actually can worsen over time as you get more nerves involved in the process, increased vascular response as well. So let's take a look at Roxy here. She's got elbow arthritis. And again, because of the inflammation, it elicits a pain response to her brain. Again, normally the brain then responds down the spinal cord, down the peripheral efferent limb, and it tells her, hey, that elbow hurts. But the problem again is over time, we get this central sensitization component that can occur both peripherally and in the spinal cord, and it makes that pain ongoing. That's why when you have, say, knee arthritis like me, I may not be doing anything. I may be sitting in a reclining chair with my knee in an elevated position, but it still hurts. Again, there's nothing good about that. There's no protection to that. I'm not doing anything. That's what maladaptive pain is and what we have to address in osteoarthritic patients. A little bit about clinical signs between dogs and cats. I think you guys get hammered on the internet recently from lots of advertisements talking about arthritis and the difference in dogs and cats. Certainly in most dogs, it's readily discernible that they have arthritis. We see them limp. We see them hold a leg in the air or not weight bear properly on it. When it comes to cats, and we'll again look at Roxy coming up the stairs here, you can tell that she's got a limp from elbow arthritis, but not all cats are that way. And many cats, they express arthritic signs as far as things like reduced activity levels. They don't groom the way they would normally do. You might see changes in their nail beds, overgrown claws, again, non-grooming or mats in areas where it's painful. And certainly we all recognize temperament changes where they certainly may not be a cat who's happy to see us, happy to be picked up or moved around. So again, not always as obvious. It's really nice, I think, in private practice to have questionnaires for clients, especially as their pets get older, to ask them some questions so you can discern as a clinician whether their patients are exhibiting some of the more subtle signs of arthritis as they get older. Because as we'll see here in a little bit, the earlier we treat, the better the outcome and the less pain these patients are going to be in. And I think at least for me, now that I'm getting older, I go to the doctor's office. And at first I hated it because I would have to fill out all these forms and questionnaires, and you get an iPad and have to fill out things. But I think most clients now are used to that because they experience that in their own MD appointments. And again, they're more than happy to, again, give you some leading information about what's going on with their pets. It may not be the reason they're there that day, but it's important for us as clinicians to discern whether or not that patient has early arthritic signs. So what do we do if you have arthritis? This is Indy. This is my World Cup soccer video. And you'll see Santi, the white cat, behind the goal. Santi's got significant arthritis. I think you'll appreciate that Indy does not, as this cat is amazing and will not allow that ball to get into the goal. Santi, the arthritic cat, would love to join in on the fun, but again, is limited because of arthritis, inflammation, and pain. So our goals with arthritis therapy: reduce inflammation, reduce that development of that maladaptive pain, hopefully, if possible, improve joint integrity. So there's, again, less frequency for injury to these damaged joints. How do we do it? Isn't this cat amazing, guys? There is nothing getting by this cat. I really need to put this cat in goal for the USA. We need to get involved in multimodal therapy. What do we mean by that term? Multimodal therapy means considering drugs that reduce inflammation and pain, using non-drug or non-pharmacologic therapy. We'll talk about some medical devices today, and then also some lifestyle changes. Now Santi is actually in the goal himself. All right. So again, as practitioners, we have been bombarded in the last decade with lots of different ways to consider treating arthritis. And the big question everybody has is, well, what is the best way, or what is the best combination of therapies that I can provide for dogs and cats to help them through this time? And we're going to go through, I guess it would take us days to go through all of these things you see on the screen in detail, but there's lots of potential puzzle pieces that we can hopefully build something that will help each patient of ours, dog or cat, in using these multimodal building blocks. And our goal is to use some combination of drugs, these non-pharmaceutical, either nutraceuticals or medical devices, lifestyle changes, but to develop a coherent puzzle for each one of these patients. It may not be the same for every dog and cat. It may not be the same for every practice. Some practices may prefer certain modalities and find success. Other practices may not and may choose to use other things. So you have to find which pieces of the puzzle work for you as a doctor, and then also hopefully what translates to success for your patients. So let's kind of go through some things today. This is not an all-inclusive, I'm not trying to make this a cutting-edge pathophysiologic internal medicine lecture today. This is more just to review what's out there and how things might work so that you can choose which pieces of this puzzle you want to incorporate to help dogs and cats in your practice. Number one, easy things, modifying that environment. Might be pretty cool to have this little thing up here on the wall where your dog or cat can crawl up there and look like they're walking on air and eat and drink, but not so cool if you have arthritis. So using things that will make it easier to get around the house, ramps, eliminating stairs, anything we can do in cats, lower lid litter boxes so they don't have to crawl over and in. They have an opening that is much more accessible to them. Again, placing food and water bowls in places where things are accessible easier. Heated beds are wonderful for pets with arthritis, just like we rely on some nice heat to keep our joints limber and less painful. Animals respond the same way. And again, there's my cat right there in her nice warm puff. That's her good elbow, I think, that she has hanging out so it can stay a little cooler while the other one gets the benefit of that nice body heat and warmth. Weight loss is another huge lifestyle change. It's estimated that probably well over half of the patients that have arthritis are also overweight. And again, increasing body weight increases the load on joints. It stresses joints. We all know that. That will push osteoarthritis and increasing levels of pain and inflammation. Statistics tell us, again, half the patients we see are overweight dogs or cats. So whatever way that you choose to do weight loss, I always tell owners, hey, this is a cheap way to help arthritis. You're feeding less, so you're hopefully saving money. You're exercising more, which doesn't cost anything. So let's get out and utilize something that, again, you'll benefit from financially as well. And let's take some weight off these patients, try to achieve a more lean body weight. And I can tell you in my own knees, it makes a big difference. Again, there's all kinds of different formulas for weight loss and plans. I'll let you pick what works best for your practice. But again, getting on the right amount of calories, limiting treats to a specific percentage, like 5% of calories per day, in addition to increasing activity. So getting out and walking more, good for the owner, good for the pet. Both probably have arthritis. Getting out, again, if you have access to swimming pools, it's wonderful to take that, that load bearing off joints and get more activity with them. Playing laser tag with cats or toy play with dogs is wonderful. You can see in my little picture down there in the lower right-hand corner, there's the one cat that did catch the laser, unfortunately, and he looks like he paid the price from an ophthalmic standpoint. Orthotic assist devices, we use them all the time in people. But doing things to give us better traction, more stability in our joints. Dogs take to these really well. Neoprene socks, again, taking actual braces, and you can do the same in cats if they're amenable to it. We all in our clinics have slings to help animals get up, get out of cages, on floors, get up and down stairs if we have them. Again, no reason an owner shouldn't have that same capacity at home to help their patients get up, get moving, and do better. So again, don't forget, you've got multiple companies that provide veterinary related orthotic assist devices, and they've really advanced in their technology, their durability over the last decade. So I would certainly consider in my arthritic patients looking into those. Okay, lastly is going ahead and getting professional lifestyle changes, things like physical therapy or assisted rehab. Certainly, we have lots of rehabilitation experts now in most of larger cities that are available to do physical therapy with pets and increase that extension, flexion, and mobility of arthritic joints. Even manual physical therapy at home for owners, if a patient is compliant with them, they can certainly do manual therapy or massage therapy to help their pets out. All right, so those were the assisted or the changes in lifestyle, simple things that clients can do. Don't forget, we sometimes as doctors overlook the simplicity of things that can change at home. We definitely want our technicians, and maybe even in a written form, literature going home with folks to tell them, hey, these are things that you can do that are going to make life for your arthritic pet hopefully more tolerable. Now, what about simple things that we identify arthritis early? Again, a reason to find it early is to make those life changes, to maybe consider chondral protectants, which are there to hopefully maintain and actually improve joint health. We've all heard of glycosamine glycans, which is glucosamine, chondroitin, and hyaluronic acid. Usually are the three components of most of these, either nutraceutical formulations or in the form of adequate, a pharmaceutical formulation. Used early, these sort of products are chondroprotectives. They can slow cartilage degeneration. That can help us repair our own cartilage, which is nice. It improves the elasticity of cartilage, so it's not a dried up piece of meat that just fractures when you do anything. And it will help reduce joint effusions and reduce synovial inflammation. We've got multiple papers that have been published in evidence-based journals in veterinary medicine since the mid-1990s. There's just a sampling of those on 2 different slides. But again, good evidence that using chondroprotectants in most studies offers at least as much benefit for joints as using an NSAID. And again, we certainly would like early on to rely maybe more on chondroprotection to help our joints in early arthritic patients before we have to later on, with more advanced disease, rely on drug therapies. The things you need to know about glycosamine glycans as far as a chondroprotectant, again, it's best to be initiated early in the arthritic process. There's probably anywhere from a 4 to 8 week delay before you may see the maximum benefit in clinical signs. So not seeing tremendous improvement in the first week or two after an adequate injection or after starting an oral nutraceutical like Cosequin is something that is expected. You want that client to at least give it a good 4 to 6 weeks before we can really maximize what we think the effect will be. So I would put nutraceuticals in something that's called the might help but won't hurt category. There's not much evidence that these products are harmful. But the key thing, again, is start early, be patient, and realize, again, the usefulness of these drugs and hopefully delaying or reducing your dependence on things like NSAIDs for arthritic relief. So definitely a place for glycosamine glycans, either in the pharmaceutical or nutraceutical components. Other nutraceuticals we can consider also are fairly potent anti-inflammatory drugs. So they may not do a lot to protect cartilage or repair cartilage, but they can reduce joint inflammation. And again, the ones that probably get the most study in veterinary medicine and human medicine for that matter would be omega-3 fatty acid supplements, the green-lipped mussel extracts, which also contain a high amount of omega-3 fatty acids, and your undenatured type 2 collagen products. Again, the key thing in all of these is they're anti-inflammatory, and most of the studies you'll see I'll put up here in a second, again, have shown us that they are probably equipotent in many situations to chronic NSAID use for chronic osteoarthritic pain. If you look at omega-3 fatty acids, again, they decrease that inflammatory cascade that starts with arachidonic acid and ends up into many of the pro-inflammatory interleukins. They can reduce not only joint inflammation, but whole body inflammation, which is nice. You guys know that you can use omega-3s for skin diseases, kidney issues, heart disease. So again, there's some whole body benefits. They can either be administered orally in the form of capsules or liquids, or they can be inherent as part of a therapeutic diet that's designed for joints or geriatric patients such as JD, JM, GD, different ones, again, different therapeutic diets by Hills, by Purina, by Royal Canin that are designed for patients that are older or have joint impairment. If you're using that kind of diet, you probably don't need to supplement further. But if you're not using a diet that is enhanced in omega-3 fatty acids, then you can use the normal pharmaceutical, or I shouldn't say pharmaceutical, the normal nutraceutical, omega caps or 3V caps or so forth. Again, we've got good literature that shows that these things work in dogs and cats with osteoarthritis. Another anti-inflammatory nutraceutical that gets a lot of attention is green lip mussels, both in humans and in veterinary medicine, specifically the New Zealand Perna caniculus green lip mussel. Again, very high in both glucosamine chondroitin, so your chondroprotective, but also very high in your omega-3 fatty acid content, which is nice. And some other antioxidants or antioxidants molecules are contained within these nutraceuticals as well. Again, there's been multiple studies in veterinary medicine, both dogs and cats, showing us again that on par, that usually for chronic osteoarthritis, inflammation, and pain relief, these nutraceuticals are oftentimes as effective as chronic NSAIDs. So again, the use of them can hopefully lessen our dependence on NSAID use, and we can oftentimes save those drugs for when the patient is more symptomatic. There's a number of other nutraceuticals out there. I've listed a bunch on this that at least have one evidence-based paper. Some of these have multiple papers that show that they help. Again, most of them contain some combination of either green lip mussels or omega-3 fatty acids. The one I listed first, though, the undenatured type 2 collagen, is a little bit more unique. This is something where you're taking a collagen orally, a treat, and it's usually made out of sternal cartilage from chickens. And again, we recognize you guys are getting a lot of attention, a lot of press and journal articles about the microbiome and its effect with the systemic immune system. So again, if you can achieve oral tolerance at the gastrointestinal immune system level to this sort of cartilage, the theory is then that you will not as aggressively attack your own cartilage. So if you have arthritis, you may be able to dampen that response. And that has been shown in multiple papers in veterinary medicine in dogs to be true. So again, it's certainly a product that I would look for in my nutraceuticals. So people ask me all the time, what do I recommend? What is the best nutraceutical supplement out there for dogs or cats? And I don't have an honest answer that I can point you to a specific supplement or a specific company. But I would say you want to look for a supplement that either contains all of these or possibly two supplements, but contains a combination of marine oils, whether they be high in fish oil or green lip mussels. You want glucosamine chondroitin, and you would like type 2 collagen. By combining those three ingredients into a nutraceutical formulation, and hopefully it's a tasty treat that a dog or cat really enjoys and wants to take, you're going to hopefully be providing a fairly potent anti-inflammatory and, again, reduction of pain on the long-term arthritic patient. So good things to do. Okay, what happens when things get a little bit worse? As time goes on, we all recognize arthritis is probably not a reversible disease at this point in our careers unless you're doing joint replacement therapies, or I guess maybe in regenerative medicine in the future with stem cells and so on. But we have to recognize the fact that over time, most arthritic patients will get worse. It's just the way it is. And as such, we oftentimes need to reach for drugs that have more of a potent anti-inflammatory effect. So pharmaceuticals, again, we want to steer away from glucocorticoids. I just read an article this morning in People. They're now saying that getting glucocorticoid triamcinolone injections in knee joints really is not what you want. You want glucosamine and hyaluronic acid injections. That the long-term effect of steroids is a bad thing. And that makes sense because steroids potentiate damage. They're catabolic. And while they might be traded off for a short-term anti-inflammatory response, they're not a good drug to be on long-term. And we all know that. So that leads us to non-steroidal anti-inflammatories. And I don't want to make this talk about that in particular, but we have all known now for decades in veterinary medicine that at least in dogs, we have on-label FDA-approved COX-2 inhibitors. You know, you've got carprofen, daracoxib, meloxicam, firocoxib. All COX-2 type inhibitors are reduce inflammatory prostaglandins, reduce inflammation, and reduce pain. And they can provide a fairly immediate response, where nutraceuticals, obviously weight loss, those things take time to take effect. So your joint hurts today, you need something like an anti-inflammatory non-steroidal drug. We also have the piperine class, which is Galliprant. Again, that is marketed, and it's a different molecule. It affects prostaglandin EP4 receptor antagonist, so it has less effects on the gastrointestinal tract, the kidneys, or platelets. So hopefully less side effects that we might see with some of the other COX-2 inhibitors. Again, that is something that we can say less effects. I would say it's not no effects. We can still see problems. So honestly, I don't really have a favorite on these drugs. I probably tend to lean more towards firocoxib based on my own experience with my own patients and with some of the literature that might suggest that COX-2 inhibitor might be preferential compared to others. But again, the important thing is we recognize these drugs can help immediately reduce inflammation and pain. What about cats? We can use these drugs in cats. Again, there's a nice paper that was published now a couple years ago, Journal of Small Animal Practice. Dr. Montero did a nice paper talking about the controversy of NSAIDs in cats and to the fact that we now have optimism that we can use those because we recognize cats require a different dose, a lower dose of NSAIDs, and they can still be used safely in the majority of those patients. So our goal with any NSAID is to use it when needed. Hopefully you have better mechanisms of use early in arthritis. Use it when arthritis starts to get severe. Try to use it intermittently at first, only when needed, recognizing that eventually as things progress, you may need to go to daily dosages. And if you do experience side effects, switch brands or types, and hopefully we can mitigate any adverse effects from those drugs. And again, don't forget that appropriate dosages, lower dosages now that are listed in pharmacies for formularies for cats can be used. Recognizing again that sometimes as arthritis gets worse, that's just not enough. And we still have significant inflammation and pain, especially from the pain, that central sensitization we mentioned, that maladaptive response. And that brings us into drugs that really don't do much on inflammation, but can certainly decrease pain response, pain transduction, and decrease that central sensitization. These would either be narcotics or maybe some non-narcotic neurologic drugs like gabapentin or amantadine. You know, one of the biggest disappointments, I think, in as far as our career goes so far, is the fact that we thought tramadol was a wonderful oral, safe narcotic to be used in dogs. Unfortunately, all of the studies now tell us that it's not a very good drug. It probably does provide some pain relief through its anti-serotonin mechanisms, but it's just not a very reliable, good pain relief drug for dogs. Now, cats, it does work well. It is a good mu1 agonist for cats. The problem is they absolutely want to kill you about the taste. They just do not like the taste of tramadol. And no matter what you flavor it with, I have found nothing that ever makes it an acceptable drug that a cat will take readily. So as Grumpy Cat says here, tramadol is probably not something that we're going to rely on to get into cats on a necessary basis. You still could use buprenorphine. Again, buprenorphine is a good narcotic drug. It's for acute deterioration in arthritis where you just need maybe a day or two to get over the hump. If you had really debilitating disease that wasn't responding to our other multimodal treatments, certainly you could still consider using buprenorphine. Gabapentin, again, a non-narcotic pain relief medication, certainly has a role in osteoarthritis patients based on studies that we've seen. It's a presynaptic drug, so it's going to reduce the transduction of the pain response in the central area. So again, decrease that central windup or sensitization. And certainly, again, there are several papers in dogs and some in cats now that suggest that gabapentin is an effective anti-pain drug. The difficulty with it is figuring out what the dose is. In dogs, that dose can be anywhere from 5 to 20 and maybe even as high as 50 milligrams per kilogram, 2 to 3 times a day. And you've really got to start at a dose and continue to escalate the dose and or frequency until you find a dosing scheme that reliably relieves pain in those osteoarthritic canines. And the same for cats, although their dose range is probably a little bit more compact in that, 3 to 5 up to 20 milligrams per kilogram, usually starting once a day. But there are some cats that, again, require the drug multiple times per day. If you can find a dose of this drug that is good to relieve pain without creating any drowsiness or ataxia, that's one of the limiting side effects. If you get too high a dose, then certainly it's a very valuable multimodal drug for advanced arthritic patients. Be careful if you're using the oral solution in dogs. It does contain xylitol. And as we all know, that's a toxin for dogs. We would much prefer you to use capsules or have the drug formulated from a veterinary pharmacy if you need to use it in canines. There is one reported paper last year talking about a pilot study using transdermal gabapentin in cats, which is nice. Again, I'm not sure that from this paper we really know the dose or the exact vehicle we should be using yet, but hopefully there'll be more study ongoing that can help us achieve a product, I hope, that will be a transdermal, reliable transdermal for the cat species. Amantadine is a very similar non-narcotic neurologic drug that relieves central pain. It acts on the postsynaptic side of the nerve. Again, going ahead, and it's been described as in its effect on reducing methyl D-aspartate. It's almost like an oral ketamine mechanism of action. It's got a much more narrow dose range, 2 to 5 milligrams per kilogram, once to twice a day in dogs or cats. It is a drug that we kind of initially were tepid in our use. We were concerned about side effects and maybe somewhat of a narrow therapeutic window. That really hasn't come to fruition. The good news is most of our patients in this dose range will tolerate amantadine well. Amantadine can be used, again, as part of a multimodal program. And in advanced arthritis, it can be used with gabapentin to block both the pre and postsynaptic central nerve transmission, again, trying to reduce that pain response that these patients experience. Again, very scarce literature so far in veterinary medicine on this drug for arthritis, but there is one paper in dogs and one paper in cats that are, again, nice evidence-based studies that show that there is an effectiveness to this drug when used for osteoarthritis. The last of the drug categories before we get into some medical devices and other things would be the new drugs you're just about to see. Some are just entering the market in the United States now, the anti-nerve growth factor monoclonal antibodies, or MABs. These are always ones that are difficult sometimes to say the name of. They have very long names that are somewhat difficult. But nerve growth factor is something, again, it's a maladaptive response. Nerve growth factor, when it's elicited in chronic arthritis, creates additional nerve growth. So you get these nerve-rich synovial areas, and you can transmit more of this inappropriate or chronic maladaptive pain response, which potentiates that ongoing achiness and joint pain. So if we can go ahead and mitigate that and block that nerve growth factor with an antibody, so it can't interact with its antigen receptors, we can hopefully have a significant reduction in the number of nerves and also how they transmit pain. So bottom line is it promotes less pain. The nice thing about these are they are injectable drugs that are given every 30 days. So think about that for a cat. What a nice thing to think is you could use this as a baseline drug and then sort of build upon it as needed. Some patients, if they have a significant enough response to an anti-nerve growth drug, may not need daily NSAIDs, may not need some of the other drugs like gabapentin or amantadine we just talked about. So in the United States, we just had the approval of Solensia this year, and it should be on our shelves. They were talking about fall to winter for cats. Solensia is frunevetmab, is the actual name of the drug. And we should see Librela, which is bedenvetmab, coming on the dog side. I hope sometime late in 2023 is the information I have. But again, once a month, injectable, baseline anti-inflammatory, anti-pain type injection. No effect on other organs that have been found in repeated studies of kidneys or livers. And again, they block that both local and central pain response. So this is something I certainly would encourage you guys to look into and to start considering it as use for sure in your multimodal patients. Okay, well, let's talk a little bit about non-drugs then. Things we can also do, we can add in that are non-pharmaceuticals that may, again, have a major impact in reducing either inflammation or pain. Basically, these are treatments, some of them medical devices, that can do a variety of different things. They can influence cellular metabolism and sort of change metabolism from a pro-inflammatory, pro-pain standpoint to hopefully a less inflammatory, less pain, and even advance cellular healing when we deal with joint osteoarthritis or other bone diseases. They can improve local blood flow. They can modulate, again, inflammation. They produce endorphins, which again can sort of be our own pain relief response. Again, they can alter gene expression, switching on genes that are pro-repair instead of pro-damage. So a lot of things can go on. And these are things that many of you are familiar with, like acupuncture, laser therapy. Maybe you're not as familiar with things like shock or sound wave therapy or pulsed electromagnetic field therapy. So let's just take a brief tour of those types of treatments. So acupuncture has been around, believe it or not, longer than me. I know I'm getting long in the tooth, so in veterinary medicine, it's been around a lot longer than me. Again, there's a variety of different types of acupuncture that are performed by folks that do it routinely, that know what they do. But the bottom line is, by stimulating that acupoint, you again are hopefully changing things into a pro-healing, a less inflammatory, and a less pain response joint compared to what osteoarthritis turns on. You're trying to turn off those things. You're doing it through manipulating cellular metabolism. Overall, in the veterinary literature, we don't have a lot of what I would consider strong evidence-based papers that describe, beyond a doubt that acupuncture works. There's lots of individual case reports and so forth. There was a nice sort of meta-analysis published last year by Dr. Huntingford. You'll see down there as reference number 3. But the bottom line becomes, when you read the papers and literature, it's hard to discern that there is a provable benefit to acupuncture. But my own experience in clients of mine that early in my career, I was reluctant to have them have acupuncture performed. Later in my career, I was much more open to that. And I have plenty of patients that have had acupuncture done, and between what the owner tells us and what the patient shows us, that definitely get improvement in osteoarthritis and other orthopedic issues. So I would, by all means, be in favor of considering acupuncture as one of your multimodal, ancillary therapies that goes along with drugs and lifestyle changes and nutraceuticals we've already talked about. The downside of it, it has to be done recurring therapies. They're outpatients. So in most times you're going to the acupuncturist. So as you can see that cat in that picture, I'm not sure that cat was that happy to know where he was going that day. That look on the face suggests to me he didn't like those needles poked in his head and all over his body. But again, that's the one drawback is that it's recurring, and it's, again, going to be done generally in an outpatient center. Cold laser therapy or low-level laser therapy uses light to do some of the same things, to stimulate cellular metabolism. Once these photons are absorbed by the local cells in the region of interest that you are lasering, we're going to hopefully change genetic transcription and do the same thing. We're going to hopefully lessen inflammation, lessen pain, and hopefully promote some potential repair to affected areas. We've got very little literature in veterinary medicine, although we've been doing laser therapy now for well over a decade and a half, if not longer. It seems to be safe as long as you're wearing those cool little sunglasses these dogs get and cats get. It's drug-free, which is nice. It's non-invasive. It's not painful. Again, there's minimal adverse effects other than maybe changing the color of the skin over areas where you perform treatment. Again, both the operator and the patient need to wear protective eyewear to not damage their eyes. Again, it's an outpatient therapy. You've got to go somewhere, and usually you require ongoing treatments. This isn't something where I can do it once or twice and then stop treatment. If there's a benefit, we're going to have to go ahead and continue likely on with some degree of laser therapy ongoing. We may be able to reduce the frequency. In cats, although I have a nice picture of a cat who looks really cool in those sunglasses, we don't have any refereed evidence-based literature to this point that really shows us that this therapy is effective. Although I think we can come to some consensus that there certainly are cats that we think clinically benefit from it, but it'd be nice to see things in an evidence-based research orientation to tell us that. Now let's look at our sponsor today, Zomedica. Zomedica is involved in using a different modality, actually 2 modalities, to do some of the same thing, to turn on or turn off cellular metabolism in areas that are involved in osteoarthritis. So we can either use electrohydraulic shockwave therapy, or some people will call it sound wave therapy or acoustic therapy. This would be the product that is marketed called PulseVet in the veterinary field. It produces really high energy sound waves. And these sound waves, just like the acupuncture prick, the laser photon absorption, sound also has an effect on local cells. And that sound frequency will change the metabolism and change DNA genetic expression, where we again can hopefully turn off things we don't want and turn on things like anti-pain, anti-inflammation. This has also been used different modalities for things like breaking up bladder stones and kidney stones and so forth in people. It's anti-inflammatory. Again, it promotes blood flow, so it's angiogenic. It's osteogenic, so it promotes healthy bone growth. And it is chondroprotective. Again, it can help protect cartilage that's undergoing osteoarthritic inflammation. It's pretty well accepted in the equine field of veterinary medicine now for quite some time. I can say I either fortunately or unfortunately am a co-owner of several horses. And certainly, as anybody who has horses know, they're going to do things that require orthopedic treatment from time to time. And again, shockwave therapy, sound wave therapy has been very beneficial in peripheral joints in reducing inflammation and pain. And again, very accepted modality in the equine medical field. When it comes to dogs, we just really kind of just started our experience with sound wave, shock waves in dogs. But I got some good news to talk to you about today. It is being used routinely in dogs and in cats. And we've been able to modify some of the earlier experience that was used on horses and earlier dogs to make this a much easier much easier and quick treatment for our dog and cat patients. So what is shockwave therapy? Well, basically the way to think about it is it's a spark that then creates a change in water vapor. It causes water vaporization, and that rapid water vaporization creates an acoustic sound. And the best way you can think about it is, depending on where you live and what time of the year, you get thunderstorms. And that spark is lightning. And within the cloud matrix, you have a lot of water. That lightning, that electrical activity, or that spark, if you will, in that cloud creates water vaporization, which then effectively creates thunder. And you can definitely tell if you've ever been close to a tree that's been hit by lightning and you're near that energy wave, that acoustic wave, you can feel it penetrate your body, can't you? You can actually physically feel thunder rattle the walls of your house, rattle the chairs, and again, it rattles us. And that's basically how this works, is we're going to be putting this acoustical energy wave into the body tissues. And again, certain cells are going to be modified, either turned on or turned off by that process. It's similar to ultrasound in a way, in that you use, similar to an ultrasound, we use a probe to effectively use sound waves to image things. Here we use a different thing. It looks almost the same, called a trode. And a trode is where we can then, through this machine, create a spark, water vaporization, and then this acoustic sound. And you'll hear the sound come out of these. The original trodes were very loud, which necessitated sedation for horses and dogs, and cats for sure. But the newer trodes, the good news is they're able to now expand the area that the acoustic wave affects, and it's not as intense. We don't have quite as much intensity in one location, so the sound is reduced. In fact, most dogs and many cats now can have these treatments done without any sedation at all. I just had this done to me 2 weeks ago, and they didn't sedate me. Now, I've had it done several times for arthritic joints, and it definitely makes an immediate response as far as analgesia goes, and then hopefully a more chronic response from the healing phase and less, chronic inflammation carrying through. So it's kind of neat the way they've been able to modify this medical device to basically make it more tolerable for the patients, less painful, again, really non-painful is a better term, and again, not as loud, so that we can still affect the tissues, but without so much acoustic sound to the patient or the operator. Again, there are multiple papers that have been written in veterinary medicine. These are small animal papers, not horse papers. I'm sure if I went there, I could find many, many more showing the benefits to electro-hydraulic shockwave or sound wave therapy. It's drug-free. That's nice. It's not going to affect other organs. It's non-invasive, which is nice. Has an excellent safety profile. 1 to 3 treatments, basically given usually at 2-week intervals. And each treatment, although I have 5 to 10 minutes there, and nowadays with the newer machines, most treatments are delivered in 2 to 3 minutes. And again, it can be repeated as necessary. You just have to shave a little area over the area of emphasis, maybe a little bit of coupling gel like you would use for ultrasound, and that'll help transmit those sound waves into the tissues. This is just something from PulseVet showing all the different sites and different energy levels and so forth that we would apply depending on what type of penetration, depending on the specific joint or area of the body that we're looking at. As you can see, this dog here, is sitting there comfortably and not sedated and getting a nice coxofemoral treatment. The other therapy that also Zomedica has, our sponsor today, is pulsed electromagnetic field therapy. So this is a similar therapy. Again, it's going to have an effect on cells, but instead of using sound, we're now using an electromagnetic field. But again, we're doing the same things as far as how we're influencing cells to become less inflammatory, less pain transduction, again, provides analgesia and overall improvement in the quality of life of patients with chronic arthritis. Again, lots of studies in human medicine since the early 1900s. You'll see a unit here on my slide, which is the black circle. And there is a transducer that provides the electromagnetic field here where you see the green lights. And that field in this example extends out about 10 inches on either side of the transmitter, and also about a 10-inch wide field as well. So we can get a pretty good wide range of coverage, especially in our small animal patients. Here you can see Zomedica has something called the Assisi medical loop, or the loop, many people will call it, where we can loop it over a joint of interest to get full coverage in these dogs. Or here you see a cat actually getting both hips done at the same time. So again, we can go ahead and penetrate that body, alter what those cells are expressing, and hopefully make them less inflammatory. What's neat about this is you can combine this at home as part of your multimodal therapy. So maybe you have Shockwave Therapy from PulseVet at the clinic, and a patient can then go home on electromagnetic field therapy to hopefully carry those beneficial effects on. Again, they act differently, but in some ways, the effect on the local tissues is hopefully the same. The nice thing about this is it doesn't require a visit to the office. Owners are able to provide this at home. And again, it can be done on a daily basis or on an as-needed basis to provide beneficial response. Again, we're just starting to see publications hitting the literature, but there certainly is a nice one that was done in Italy back in 2012, one of the first publications showing the effect and the useful of this in osteoarthritis in dogs. Comparing it to ferrocoxib treatment was found to be non-inferior to ferrocoxib, which is a nice thing to see. And again, there's just a picture of the Assisi loop. There's different sizes depending on the patients that we're treating, cats versus dogs. The way we use this loop at home would be for 15 minutes. You press a button, it turns on, it'll run for 15 minutes and produce this electromagnetic field that, again, influences cellular metabolism. You can do it 2 to 4 times daily initially until you see a clinical response, and then you taper how often you use it. Each loop, I believe, has about 300 treatments in them. It's also possible to use a pad that produces electromagnetic field as well. Here you see a larger breed dog sitting on a pad that's going to produce the same thing to both of those elbows and probably both of those hocks and probably that knee that's tucked underneath and on top. So again, when we need to do more of a whole body treatment, we have that ability to perform this pulsed electromagnetic field therapy. Again, you see cats, they also have a cushion for cats, which you can either use independently if your cat will sit there for 15 minutes. If not, you can place them in this little carrier, again, called a loop lounge, and keep the patient in there for 15 minutes while they take their therapy for the day. So this is a really nice thing that builds into and complements the other modalities we've talked about today that people can do at home. So let's finish up and just talk about 2 minutes or so on a couple other things. Cannabinoids, I mean, again, I think right now we're still in our very early stages of understanding the use of cannabis as an anti-pain, an analgesic agent, or an anti-inflammatory agent. Maybe there's some chondral protective effects of cannabis as well that have been described. We're just starting to see the evidence-based studies coming out. And the good news is there's quite a bit of research interest here. And we're seeing multiple papers come out. You see a number of them there, a number of them here that are coming out again in 2021 and 2022. Bottom line becomes, it appears that there's not a lot of regulatory issues with cannabis use right now in animals. But again, be aware of where you practice and what your state regulatory agencies tell you. Number 2, we're starting to see pharmacokinetic studies, so we're getting some ideas of what the dosages are when we give this nutraceutical orally, or pharmaceutical, I suppose, if it ever gets approved for use. We're seeing that it seems to be safe. There's some minor issues that have come out in some papers about some minor increases in liver enzymes. But again, so far, we haven't seen any consistent, significant adverse effects. I would keep my eyes on cannabis. I think it's certainly something that if an owner wants to use it, I don't have any problems incorporating it, again, as part of a multimodal approach. And again, there certainly may be some benefit from these endocannabinoids that are produced that provide pain relief. Stem cell therapy and platelet-rich plasma therapy, again, ways to try to rebuild joints as we produce less inflammation. Again, still very much in its infancy and still somewhat of a fringe therapy, both in animals and in people. I know certain colleagues would disagree with my use of the word fringe therapy, but it's an expensive therapy. It's an invasive therapy. And it's one that just has certainly not so far proven to be so effective that it should be considered in every case. I hope someday that is what happens. Several universities have divisions or departments now looking at regenerative medicine. I hope this will be a continual therapy of the future. I certainly at this point in time don't advocate it for every osteoarthritic patient I see. What I would suggest is that owners that have big interest in it and bring it up to me, I'm more apt to have a discussion and see if they would like to pursue it. But again, I'm not a regenerative medicine center. I'm more of a traditional treatment for osteoarthritis. And again, there's very little literature so far that's been published, but I'm sure there'll be more to come in these 2020s. Radioisotope therapy is again something that we don't have any so far papers that tell us it's effective. Radioisotope means we inject a radioisotope into a joint that ties up macrophages for 6 months or so, maybe up to a year, and then you reduce inflammation and thus pain. We know it's safe. There's no adverse effects in one canine elbow arthritis model, but we're still waiting to hear about clinical response in clinical studies. So guys, that's the end of today's talk. And again, I oftentimes tell people we sometimes call this talk aging is mandatory, pain is optional. Again, as we said earlier today, make the diagnosis of osteoarthritis early. Adjust things in the house so it makes it easier for osteoarthritic pets to get around. Lose weight. If you're overweight, that'll make a tremendous ability to take a load bearing off of these joints. Using early nutraceuticals and chondroprotectives, if we can identify these patients early, is a wise idea. At that stage, they're probably just as good as an NSAID. As things progress, let's remember we can get into drug therapies like NSAIDs and anti-nerve growth factors and our neurogenic drugs like amantadine and gabapentin. Be very careful with polypharmacy in cats. We all know that. Most cats don't get most drugs most of the time. So when we're relying on oral therapy for osteoarthritic cats, it may not be the best thing. These anti-nerve growth factors and medical devices like Shockwave and pulsed electromagnetic field therapy are probably much better tolerated by cats. And you can see in my multimodal picture I just popped up, these cats are saying that's exactly right. And then lastly, experientiae docce. Experience will teach us, guys. We still need to know a lot more about a lot of things in medicine, especially cannabis and regenerative medicine. So time will teach us about those things.